The fluorescent lights hummed overhead like insects trapped in plastic, casting everything below in a pallid glow that made the antiseptic smell seem visible. Cedar Creek Medical's ICU sprawled across the third floor of the Colorado Springs facility, 12 beds arranged in a semicircle, each one a small theater where lives were negotiated in milliliters and heartbeats. The morning shift had already been running for 3 hours. Megan O'Brien moved between monitors with a rhythm that had become muscle memory during her first 90 days here, her hands steady as surgical lasers as she checked the dressings on trauma patient in bed 7, adjusted the foredrip on the elderly woman in bed 3, and documented vitals that would eventually be read by physicians who would never know her name. She preferred it that way. The badge clipped to her scrubs read M. O'Brien, RN in white letters against a laminated background photograph that had been taken 2 months ago, before the whispers started. Before her competence began to feel like a liability instead of an asset. Megan had seen it coming from the first week, the sideways glances from nurses who'd been at Cedar Creek for 5, 8, 12 years, the way conversations died when she entered the break room, the careful distance people maintained when she passed them in the corridor. None of it had ever bothered her before. Invisibility was a tool she'd learned to sharpen. The unit patch sewn inside the lining of her jacket, visible only to her when she hung it in her locker each morning, bore the insignia of SEAL Team 3, Charlie Platoon. The stitching was faded, the edges worn soft from 18 years of hands checking that it remained in place. From Baghdad to Ramadi to Helmand Province to a dozen places that didn't appear on maps. And now to Colorado Springs, to an ICU ward where the most dangerous thing she had to worry about was the charge nurse's scheduling algorithm and the coffee in the staff break room that had been sitting in the pot since 6 in the morning. Grand rounds began at 8:15, precisely on schedule. They gathered in Conference Room B, a space designed to be clinical in every sense, grey linoleum, windows that looked onto the parking lot, a long table where attending physicians, residents, fellows, and senior nursing staff arranged themselves in an unofficial hierarchy that everyone understood. Megan stood with the other ICU nurses, her tablet holding her notes on the current patients, her white coat buttoned and her expression neutral. Dr. Richard Pierce, Ivy League medical degree, fellowship from Johns Hopkins, 3 years at Cedar Creek and already working to ensure that everyone understood his credentials held more weight than mere competence, was already circulating through the cases, his voice moving through the room like something that could leave marks. When he reached the summary of her charts, something shifted in his posture. "Interesting work here," he said, and the way he said it made the word interesting sound like a disease vector. He held up her documentation on Morrison's admission, the preliminary assessments, the vitals charting, the medication reconciliation. Textbook perfect. Suspiciously flawless protocols. No deviation, no uncertainty, no margin for the kind of human error that actually defines real clinical experience. Megan kept her eyes forward. Her hands didn't move. "You know," Pierce continued, warming to his theme the way some men warm to power itself, "I've been reviewing charts for 16 years. Navy training, actually. Medical Corps." He paused for effect, letting that credential settle. "And I've never seen a nurse with less than 5 years of clinical experience produce work this clean. Either we have a prodigy on staff, or someone has been very carefully manufacturing the appearance of expertise." The room went silent. Not the comfortable silence of medical professionals considering diagnostic possibilities, but the thick, terrible silence of a room watching something wrong happen in slow motion. "Perhaps," he said directly to Megan now, his voice dropping to the tone men use when they're about to destroy something just to hear the sound it makes, "we should ask you about your credentials. Where exactly did you train, O'Brien?" Her jaw tightened. A single muscle along the line, barely visible, barely enough to register. She didn't blink. "University of Colorado School of Nursing. Denver. Graduated cum laude. Licensed in Colorado, Federal PTIN certification, BLS and ACLS current as of January. And before that?" Pierce's smile had teeth. "What's your background?" "Medical emergency response." That was all she said. The shortest truth that could contain an 18-year career without saying anything true at all. "Various locations." Vague credentials for someone with such precise work. He set the tablet down and turned to the assembled group, his voice regaining its public amplitude. I want all of O'Brien's documentation reviewed going back to her hire date. I want every chart compared against the clinical notes from attending physicians. If there's any deviation, any suggestion of fabrication, that becomes grounds for immediate investigation. No real nurse produces this kind of perfect work. It suggests either a forgery or someone who never actually earned the right to be working in this field. The fluorescent lights buzzed. Somewhere down the corridor, a ventilator wheezed its mechanical rhythm. Megan turned a page on her tablet and continued noting the next patient's status, her hands moving with the same steady precision that had just been publicly questioned. Her co-workers were no longer meeting her eyes. The meeting continued for another 18 minutes. Pierce moved through the remaining cases with restored confidence, his accusations unanswered, his implications accepted into the room's air like a gas leak that nobody wanted to acknowledge. When the group dispersed, Megan remained standing by the window overlooking the parking lot, where rain had begun to fall against the glass in small deliberate impacts. 2 hours later, she was monitoring the isolation room in the ICU's East Wing when they brought him in. The medevac notification had come through 36 minutes earlier: incoming trauma, Navy SEAL, major chest injury, call sign Darkwater 6, high priority transport from Brooke Army Medical Center at Joint Base San Antonio. The information appeared on the unit board in clinical shorthand: Lieutenant Commander Jake Morrison, GSWX2 to chest and right shoulder, penetrating trauma to mediastinal cavity, fractured left clavicle, field thoracotomy performed in Baghdad, transport time 44 minutes, ETA 0815 hours. When they wheeled him in, Megan was the first person on the team. He was pale from blood loss despite the 4 units of O-positive they'd run into him en route, his breathing shallow and fast despite the oxygen support, his right arm immobilized and his entire torso wrapped in pressure dressings that would need changing within 6 hours. The combat medics had done good work, the kind of work you only learned in the field, where mistakes meant losing people before the ambulance could even arrive. The kind of work that left scars across the chest and soul both. Megan began checking the monitors, attaching the leads, starting the continuous cardiac surveillance that would be the first warning if his heart decided to stop. Her hands moved on their own, the assessment happening without conscious thought: airway clear, breathing supported, circulation maintained but marginal, disability assessment negative, exposure assessment showing no secondary injuries. A plus B plus C plus D plus E. The acronym that meant survival. It was when she was checking the placement of the central line that she saw it. Tattoo. Ink dark against his pale shoulder, partially visible above the compression dressing. 2 words in Arabic script. And below it, smaller, the insignia of SEAL Team 3, Charlie Platoon. The same unit insignia that was sewn into the lining of her jacket. The same patch she'd been checking every morning for 18 years to make sure it was still there. Her hands didn't stop moving. Her eyes didn't linger. Her pulse remained steady. This was why she was here. This was the entire architecture of the nursing job, the placement at Cedar Creek, the decision to take a position below her capability and live inside a false identity for months until the right patient arrived. Morrison's command had called 23 days ago. They needed someone inside Cedar Creek because Morrison was coming there, and they needed someone they could trust completely to monitor him through recovery without raising counterintelligence flags or external scrutiny. The Pentagon didn't arrange hospital placements for routine recoveries. She finished the assessment and began charting the vitals with the same precision that had just made her look suspicious, documenting Morrison's presentation, his current status, the monitor readings, the medication list, the fluid balance. All of it clean. All of it perfect. All of it exactly the kind of work that made Dr. Pierce certain she was a fraud. "You with him?" one of the transport paramedics asked. He was still holding the monitor leads, waiting for her confirmation that he could hand off. "Captain O'Brien. I'll be his primary nurse." She said it the same way she said everything, no emphasis, no claim of authority, just a statement of fact. "You can transfer to me." The paramedic handed over the line and the vital sign sheet and left her alone with Morrison, with the monitors, with the knowledge that she had 72 hours to get him stable before his real recovery could begin. She pulled a chair close to the bed, close enough that she could reach the 4 pump if it started alarming, close enough that she could see his face if his breathing changed. His eyes were closed. He hadn't spoken since arriving. She picked up her tablet and began the documentation that would become the record of his survival or death, and she didn't notice the way the other nurses had stopped entering his room except when absolutely necessary, didn't notice that Dr. Pierce had walked past 3 times already, watching her work with an expression that had moved beyond simple contempt into something more calculated, didn't notice that the entire machinery of Cedar Creek Medical had shifted its weight slightly, trying to decide if it should trust the quiet nurse with steady hands or the physician with the prestigious credentials and the willingness to say things out loud that other people were only thinking. The monitor beeped steadily. Sinus rhythm. Normal rate. Morrison's heart was working. For now. Morrison's monitor beeped its steady rhythm as Megan finished documenting his vitals on the tablet, 2:22 a.m. according to the wall clock above his bed. The ICU corridor stretched quiet behind her, skeleton crew tonight, 3 nurses covering 12 beds, which meant nobody would witness what happened next. She didn't know that yet. The vending machine hummed in the break room alcove near the main desk, fluorescent light spilling across the linoleum tiles like a spotlight waiting for its actor. Dr. Pierce stood there at 2:56 a.m., holding his coffee and deliberately not buying anything, watching the hallway with the patience of a predator recognizing an opening. He'd been tracking her schedule for 3 weeks, which nights she worked, which moments she stepped away from Morrison's room, which staff members had started treating her with visible respect instead of the skepticism he'd been carefully cultivating during grand rounds. Megan needed water. 1 cup. The break room was 30 feet from Morrison's room, close enough she could hear his monitor from there, far enough that Pierce had calculated his angles with bureaucratic precision. She turned the corner and he was there, standing between her and the machine, his white coat crisp as a knife edge. 3 security guards clustered near the vending machines, not actually there for a break, she realized. Called ahead. Staged. Captain O'Brien, Pierce said, his voice carrying the texture of a vice closing, smooth and incremental. Not loud enough yet to draw staff. I need to see your credentials. Again. Megan stopped walking. Her hands remained at her sides, palms open. Around them, the break room felt smaller than it had 60 seconds ago. My credentials are in the system, she said, each word level as a carpenter's line. Not defensive. Not deferential. Factual. Your credentials are suspiciously pristine, Pierce continued, stepping closer. The 3 guards didn't move. They were there to be witnesses, not to intervene, though everyone would interpret their presence as validation of his authority. Your charts. Your protocols. No nurse works this cleanly for 3 months without cutting corners. No one. He smiled, the expression never reaching his eyes. So either you're a fabrication walking around in stolen scrubs, or you're the first perfect human being I've met, which seems statistically impossible. The word landed exactly where he'd intended, fabrication. Not a question. An accusation with legal teeth. Megan didn't blink. Didn't step back. The guards watched her face for a crack, some sign of panic or shame, and found nothing. She stood there like someone waiting for a bus, internal as stone. My RN license is current with the Colorado Board of Nursing, she said. My documentation is available for review. So clinical, Pierce said, layering contempt into the syllable. So rehearsed. Tell me, who trained you to memorize responses like that? Some online diploma mill? Some private contractor with a rubber stamp and no ethics board? He pulled his phone from his coat pocket. Because I'm having your credentials verified right now. Every single one. And if I find even one inconsistency, one gap, one discrepancy, security is escorting you from this building pending a full background investigation. The guards shifted their weight simultaneously, a choreographed movement that made it clear this wasn't a hypothetical. I understand, Megan said. That was all. Not I'm sorry. Not I didn't mean to. Not a single defensive word. Just acknowledgement, delivered in a voice that sounded like someone confirming they'd received a weather report. Pierce's jaw tightened. That reaction, or the absence of it, had the texture of a fist hitting water. She wasn't supposed to be calm. Fear was supposed to make her explanatory, emotional, easy to dismiss as unhinged and unstable. Instead, she delivered 3 sentences and erased his leverage entirely. "We'll see how perfect your documentation looks under scrutiny," he said, turning back toward the main floor. The guards followed. No one had raised a voice. No one had threatened her directly. But every nurse who'd been within 50 feet of that interaction would hear about it by shift change, twisted and amplified with each retelling. By morning, half the hospital would be convinced her credentials were forged. By the time actual verification arrived, the damage would be baked into the institutional perception. Megan filled her cup with water from the cooler, her hand steady as a surgical needle. She drank it in 3 swallows and returned to Morrison's room. The next confrontation came during formal rounds at 4:13 a.m., when the ICU attending brought the resident team by each bed to discuss the night's cases. Pierce was there, clipboard held like a weapon. Morrison's bed was third in the rotation. "Captain O'Brien, walk us through the dressing change protocol you performed at 23:30 hours, Pierce said, addressing her in front of 6 residents, 2 nurses, and the attending physician. His tone suggested he was about to expose a critical failure. Megan stood beside Morrison's bed, her hand resting on the rail, completely unhurried. Sterile field established. Chlorhexidine scrub for 2 minutes. Existing dressing removed with appropriate timeline to prevent bleeding disruption. Wound assessed for cellulitis, none observed. Irrigation with normal saline at body temperature. Redressed with ABD pads and elastic bandage to compression specifications." "Interesting," Pierce said, and the word carried a knife's edge of suggestion. "Because in my experience, combat-related thoracic trauma at Morrison severity typically presents with infection markers by day 2. Yet your documentation shows 0 fever, 0 signs of systemic infection, and a wound bed that looks like it was handled by a surgeon instead of a nurse." He turned to the residents. "This is a textbook example of documentation that's almost too good to be true. Notice how there's no uncertainty. No mild erythema, monitoring, or the possible early signs. Everything is either perfect or absent. That's not how reality works. That's how someone fabricates a chart to cover their tracks." The resident shifted uncomfortably. The attending physician said nothing. Megan's jaw clenched, just barely visible, a micro-movement that lasted maybe 0.2 of a second. Then it stopped. "Morrison's wound was clean at last assessment," she said, voice unchanged. "I can walk you through the current status if you want to examine it." "That won't be necessary," Pierce said, as if he'd been trying to save her from embarrassment. "I'll conduct my own independent assessment. Standard protocol when we have questions about documentation integrity." He moved to Morrison's bedside and began unwrapping the dressing himself, which Megan had changed with sterile technique exactly 90 minutes ago. Pierce was approximately 30 seconds into this when Morrison's eyes cracked open, the first movement anyone had seen from him since admission. Morrison's gaze found Megan first. Then tracked to Pierce. "Who?" Morrison's voice came out as sandpaper dragged across concrete, 3 days post-emergency intubation, but the word landed with the weight of a command. Pierce stopped unwrapping. "It's all right, Lieutenant Commander. I'm just verifying your wound care." "Not you," Morrison said, his focus returning to Megan. Who is she?" Megan stepped closer to the bed, her hand moving to Morrison's arm in a gesture that Pierce couldn't quite classify. Not personal. Not unprofessional. Something else. Something military in its precision. "Your nurse," she said. "You're at Cedar Creek Medical. Colorado Springs. Day 3 post-transfer. All vitals stable." Morrison's eyes held hers for exactly 2 seconds, and in that interval something passed between them, a recognition that lived entirely in a space where words didn't exist. Then his eyes closed again. Pierce finished the dressing change in silence and left the room without speaking. By 4:51 a.m., Megan's email inbox contained a formal complaint filed with hospital administration. Pierce had documented his concerns about her credentials, her documentation practices, and her inappropriate patient familiarity in language that would normally be associated with a nurse sleeping with a patient. 7 pages. Single-spaced. Footnoted with specific dates and times and alleged deviations from standard protocol. He'd CC'd the nursing director, the hospital's credentialing office, and the Colorado Board of Nursing. Megan discovered this when she checked her phone during a 5-minute break, standing in the stairwell where nobody would see her process information. The words on the screen weren't surprising. The speed of execution was impressive. He'd had this prepared, waiting for the moment when one of his earlier accusations stuck enough to justify escalation. She set the phone down on the stair beside her, looking at the screen like someone studying a map to an enemy base. 2 minutes later, a code blue alert sounded through the hospital speakers. Not Morrison's room. Trauma Bay 2. Multiple casualties coming in by helicopter, ETA 6 minutes. The evening shift had been getting ready to go home. Instead, every available body began moving toward the trauma bays with the organized urgency of a military operation. Megan stood up, slipped the phone back into her scrub pocket, and walked toward the chaos. The rotor wash shook the windows of the entire east wing as the helicopter descended toward the helipad on the roof. Megan could hear it from inside the hospital, that particular signature sound of a Black Hawk coming in hot, blades catching the Colorado Springs night air like a drum rhythm that meant people were bleeding somewhere in the darkness. The sound triggered something in her lower spine, a vibration that had nothing to do with actual physics. She was in Trauma Bay 2 by the time the first stretcher came through the doors. Gunshot wound to the abdomen, civilian, approximately 34 years old, BP 78/52 and dropping. Sucking chest wound. Tension pneumothorax building in the right lung. The resident on duty began fumbling with the equipment for needle decompression, his hands moving with the hesitation of someone who'd learned this in a classroom instead of in the actual dark, with actual blood, with the actual smell of diesel fuel and copper and death pressing down from every direction. Pierce was there too, coat already off, rolling his sleeves with the air of someone about to take control of the situation. And then he made a choice that was technically correct but practically catastrophic in this particular case. He called for a chest tube, reached for the equipment, and began setting up for a procedure that would take him for minutes to execute when the patient had maybe 90 seconds of viable cardiac output remaining. Megan was already moving. The smell hit her first, not the blood, but the specific diesel and dust combination that meant she wasn't in Colorado Springs anymore. She was in Baghdad. She was in a compound that had taken a mortar round through the second floor, and the blast doors were twisted metal and hot enough to burn through rubber, and Captain Reeves was screaming because his leg didn't have a foot attached anymore, and Morrison was still conscious and asking how many down. The fluorescent lights above the trauma bay became the bare bulb hanging from a generator-powered cable, swaying in the superheated air. The tile floor became concrete sticky with blood. The monitor beeping became radio chatter stacked on top of gunfire stacked on top of the shrapnel sound when the secondary device detonated. She blinked. The desert was gone. But her hands were moving on their own, already reaching for the needle she would need, already orienting toward the patient's anatomy with the certainty of someone who'd done this procedure 800 times instead of in training simulations. Her voice dropped an octave. Commands, not requests. Needle decompression, she said, not to anyone in particular but to the entire trauma bay. Second intercostal space, midclavicular line. I'm moving. The resident started to step away from the patient. Pierce looked up from his equipment setup, his expression suggesting he was about to remind everyone about scope of practice and chain of command. That was when Megan moved, and every single person in that trauma bay froze. The alarm screamed first. One long, piercing wail that turned every head in the ICU toward Trauma Bay 3. Morrison's monitors had flatlined, not the gradual decline of a failing patient, but the sudden, catastrophic collapse of a body that had already survived Baghdad's worst. Dr. Pierce was there in seconds, moving with the hurried uncertainty of a man who'd never actually performed field medicine. He fumbled with the crash cart, his hands trembling as he tried to locate the defibrillator pads. A resident nearby stood frozen, staring at the flat line like it was a personal insult. The nurses clustered around Morrison's bed, checking lines, calling out vitals that didn't exist, no pressure, no oxygen saturation climbing from the monitors. Nothing. Just the steady, mocking beep of a flat line. "Get the crash team," Pierce said, his voice cracking slightly. Not commanded. Requested. Megan was already moving. She didn't run. Didn't panic. Her body was remembering something her civilian credentials didn't list: 17 months of operating on soldiers in a compound that smelled like diesel and blood, where the electricity went out every other day and you learned to work by the light of a field lamp because waiting wasn't an option. Operating under indirect fire, where triage protocol meant deciding in 4 seconds who lived and who didn't, and your hands had to be steadier than your heartbeat because pain was information, and shock was a luxury you couldn't afford. The muscle memory wasn't asking permission. She shouldered past Pierce, not violently, just with the absolute certainty of someone who knew exactly what needed to happen next. Her hands moved on their own. A 14-gauge needle from the surgical tray. She didn't need to ask for it. She knew where it was. Knew the angle. Knew that Morrison's left intercostal space, between the 5th and 6th ribs, was her entry point. "What are you doing?" Pierce's voice was still trembling. "That's not protocol. Step back. You're exceeding scope of." She didn't acknowledge him. The needle went in. She felt the resistance of the intercostal muscle, then the sudden give as she broke through into the pericardial sac. The hiss of air escaping. Decompression. Morrison's blood pressure responded immediately, a reading that had been pure flatline suddenly flickering back to life on the monitor. "Scalpel," she said. Not requested. Commanded. A resident placed it in her hand. She made the incision with the kind of precision that comes from having done it without the luxury of anesthesia, without the certainty that the next breath would come. Left anterolateral thoracotomy. The words came to her in her own voice, but also in the voices of the trauma surgeons who taught her in a compound outside Fallujah, where the only textbook was the body in front of you. The chest cavity opened. She could see the damage immediately, the penetrating wound from the IED shrapnel that had been traveling through Morrison's thorax for 2 days, waiting for the moment when inflammation and infection would push him past the threshold where blood pressure alone could keep him breathing. A routine dressing change had been his breaking point. Her hands found his heart. It was still. She began compressions, manual, direct, the way they'd taught her when there wasn't a beating heart monitor to hide behind. The way she'd done it for 7 Marines and a Navy corpsman whose names she still remembered in her sleep. Compression. Release. Compression. Release. Epinephrine. 1 milligram 4, she said. Her voice had dropped an octave. Not the voice of the nurse they'd been mocking in the hallway. The voice of someone who'd watched people die from hesitation. The resident pushed the medication. O2 saturation? Her eye stayed on Morrison's heart, on the pale, unresponsive tissue beneath her fingers. 68% and dropping, someone called out. Compression. Release. Compression. The room had gone completely silent except for the monitor and the squeak of the resuscitator bag as someone worked to oxygenate him. Not a request. Not a debate about scope of practice. Just the sound of a life being fought for with the kind of economy of motion that comes from knowing you might have seconds, not minutes. 72, the resident reported. Compression. Release. 79. She could feel the tissue beneath her hands beginning to respond. The heart was fighting back. That's what people didn't understand about manual compression. It wasn't violence. It was conversation. The heart was asking her if she believed it could restart, and her hands were answering yes, over and over, with the kind of certainty that only comes from having already seen what happens when you stop trying. 85. The rhythm changed. A flutter at first. Then something that looked almost like sinus rhythm emerging from the chaos. Morrison's eyes twitched beneath closed lids. His fingers spasmed. His body was remembering that it was supposed to be alive. 88, the resident whispered. 90 seconds. That's all it had taken. The time it took to brew a cup of coffee. The time it took to walk from one end of the ICU to the other. The time it took for Megan to remind Morrison's body that it had survived worse. She stepped back as the crash team took over, as the defibrillator was applied, as the machinery of modern medicine reasserted itself with protocols and procedures and the kind of caution that only existed in hospitals where people had time to be cautious. Morrison's heart was beating. Not strong. Not stable. But beating. The monitors climbed steadily, 92%. Stable. Pierce was staring at her hands. Not at her face. Just at her hands, which were still steady, which weren't shaking, which looked like they'd just performed a 15-minute surgery in 90 seconds without hesitation or doubt. One of the residents stepped back slightly. His eyes had moved from her hands to her face, and she could see the moment a question formed behind his eyes. The kind of question that didn't have a nursing school answer. The kind of question that came from watching someone operate like they'd done this before. Like they'd done this when the alternative was watching someone die. Pierce cleared his throat. His voice was still trembling. She's exceeded protocol. She's exceeded her scope. I'm documenting this as an unauthorized procedure. This is. But Megan was already moving toward the medication cart, checking Morrison's full line, her movements flowing from one task to the next with the kind of precision that made inefficiency look like a personal insult. She pulled her hands back into her sleeves, and no one in that trauma bay had seen anything but a nurse doing her job. Exactly. Perfectly. Without hesitation. No one had seen the faded unit patch sewn inside her jacket lining. No one had noticed that her hands had been marked by the same surgical procedures that didn't exist in any civilian hospital, performed in conditions that would have made every attending in Colorado Springs faint. What they didn't know was that Captain Megan O'Brien had just saved the life of her commanding officer. The man who'd written the letter of recommendation that had allowed her son to transfer out of the Baghdad deployment 2 months before the IED that had taken 17 other soldiers. The man whose life, apparently, was worth more than her career. The heart monitor settled into its steady rhythm. Sinus rhythm. The room held its breath, and for exactly 3 seconds, nobody moved. Then Dr. Pierce's face drained the color of old bone. He stood by the crash cart, his hands still trembling from the moments before when Megan had shouldered past him, when she'd moved with a precision that belonged in an operating theater at Walter Reed, not in a community hospital trauma bay. His Ivy League pedigree had frozen in the face of muscle memory that looked like magic. He knew what he'd just witnessed. He knew he couldn't prove it. And he knew, with absolute certainty, that she had just become his irreversible problem. Step back from the patient. His voice came out thin, reedy. An order that nobody heard. Megan was already moving. She checked Morrison's pupils, verified the monitor strip, confirmed the 4 lines remained patent. Her hands moved with the methodical precision of someone who had done this before, not in training videos, not in certification courses, but in the dark under fire in the Jolan district of Fallujah, where every second counted and there was no code team waiting in the wings. She didn't acknowledge Pierce. She didn't even look at him. Get him to surgical. Her voice dropped an octave when she gave orders. Clinical. Authoritative. The voice of someone accustomed to command. 2 residents snapped into motion. Pierce watched her move, and his jaw clenched so hard his teeth hurt. She was already turning away from Morrison, already dismissing him from her orbit like he was furniture. Like he was nothing. His hands curled into fists at his sides. By morning, he had filed 3 formal complaints. By noon, he'd filed 7. The first was with the hospital's Patient Safety Committee, invoking Section 4.7 of the Colorado Nursing Practice Act regarding scope of practice violations. The second went to the State Board of Nursing, accompanied by a meticulously itemized summary of every procedure Megan had performed outside her authorized scope in the past 3 months. The third landed on the desk of Cedar Creek Medical's chief compliance officer, a woman named Patricia Huang, who owed Pierce a favor from his work on the hospital's credentialing committee. That one came with 30 pages of supporting documentation, dates, times, patient names, specific procedures, all formatted with the precision of a hunter who had been tracking his prey for months. Because he had been. Unauthorized intubation. Page 4. Performed without physician supervision or standing orders. Page 5. Patient outcome does not excuse violation of scope. Page 6. He had documented everything. The 3 thoracostomy kits she'd requisitioned. The way she'd been absent from the unit during 2 separate level 1 traumas while still clocking out at normal times. The fact that her charting was too perfect, not the loose, efficient shorthand most nurses developed over years, but the precise, technical notation of someone trained to military medical standards. He had been waiting for his moment. Now he had it. Patricia Huang suspended Megan pending investigation at 2:37 p.m. on a Wednesday. No hearing. No review. Suspension pending outcome of compliance review. Standard procedure. Ironclad. By 3:13 p.m., Megan had turned in her badge and cleared her locker. She didn't protest. She didn't cry. She simply nodded, removed the ID badge from her lanyard, and walked to her assigned locker. The other nurses avoided her eyes. The ones who'd been friendly before suddenly had pressing tasks in other units. She understood the calculus. Guilt by association was a currency everyone traded in. Being seen with her now was bad for their careers. The locker door swung open. Her extra scrubs. Her compression socks. Her name-brand stethoscope that she'd bought herself, not the cheap plastic hospital-issued ones. And in the back corner, folded small enough to hide in a shoe, was the faded unit patch. Sewn inside the lining of her jacket for the past 3 months. The same patch that Morrison wore. The same unit designation that connected her to the classified operation that had brought her here, to this hospital, to this moment. She held it for a long time before placing it in the cardboard box that administration had provided. Everything she'd brought into this place fit into 18 liters of space. Her entire civilian cover, compressed into a container that looked like it should hold dishes or books. The rain started at 4:17 p.m. By the time she'd driven 6 blocks from Cedar Creek Medical, past the intersection of Cascade Avenue and Palmer Park Boulevard, into the parking lot of the Starlight Diner, the rain had turned biblical. It hammered against the windshield in sheets, the kind of downpour that made visibility drop to 20 feet in either direction. She parked at the far edge of the lot, away from the streetlights, and sat in the darkness watching the water stream down the glass like it was trying to wash away something that wouldn't come clean. Inside the diner, there were 3 other people at 3:06 a.m. A trucker in a booth nursing cold coffee. An older woman working the register who didn't look up. A man at the counter who kept his eyes on his phone. Nobody was interested in the woman with the wet hair and the cardboard box sitting alone in the back booth. Megan ordered coffee. Black, no sugar. She wrapped both hands around the mug but didn't drink. She watched her reflection in the window, a woman she barely recognized anymore. 3 months ago she'd had a mission. 3 months ago she'd been part of something that mattered, something that connected to the larger machinery of national security. 3 months ago she'd been Captain Megan O'Brien, not just a nurse. The coffee cooled. Steam stopped rising from the surface. 30 minutes passed. 45. At 3:51 a.m., her phone buzzed. An encrypted message from a number that didn't exist in any normal database. Her operational handler. Cover compromised. Do not attempt recontact with subject until cleared. Mission architecture remains classified. Your placement at Cedar Creek was authorized at highest levels. Objective: maintain proximity to Lieutenant Commander Morrison without raising counterintelligence flags. Nursing position provided security clearance cover. Blowing assignment means losing operational eyes on potential security breach inside facility. You understand implications. She read it twice. The message deleted itself, as they always did. Megan stared at the blank screen. The math was simple. Pierce had torpedoed her cover to protect his ego. She'd saved Morrison's life, which meant the primary objective was complete. Morrison was stable, already showing signs of recovery that suggested he'd regain full mobility within 3 weeks. The secondary objective, whatever security breach Pierce's complaint had accidentally exposed, now had no eyes on it. Nobody watching. Nobody ready. Except she was suspended. Fired. Finished. She pulled the faded unit patch from the cardboard box. It was old, worn at the edges where it had been sewn and re-sewn. 15 years of combat stitched into a piece of cloth. Baghdad, 2009. Helmand Province, 2011. A third deployment she'd never talked about, never written in any official capacity. The patch had survived the IED that had taken 17 soldiers from Charlie Platoon. It had survived the field hospital tent where she'd been the only person qualified to perform field thoracotomy without the luxury of an operating room. It had survived because she'd cut it from the uniform of a friend and tucked it inside her jacket, against her skin, so she'd never forget what survival cost. The patch felt impossibly small in her hands. Useless. What good was history when your current was collapsing? She almost threw it into the trash can beside the booth. She actually stood up, crossed to the bin, held the patch over the opening. All she had to do was let go. The diner's television was on mute, tuned to CNN. Breaking news ticker running across the bottom. Something about a Pentagon announcement. She didn't care. She dropped her eyes back to her hand, to the patch, to the thing that was supposed to matter more than a career or a reputation or anything else in the world. And she couldn't do it. Not because she was weak. Because she knew exactly what the patch meant. It meant 17 soldiers would never eat another meal. It meant their families would never stop waiting for phone calls that would never come. It meant her son, Morrison's junior officer, the one he'd ordered to stand down from the Baghdad deployment, was still alive because of decisions made in chaos that had worked out in ways nobody could have predicted. Megan put the patch back in the box. The rain continued hammering the glass. Her coffee was cold enough now that it looked like brown water. She'd been sitting in this booth for 53 minutes and nobody had asked if she wanted a refill. That was fine. She didn't want anything. She wanted. The sound cut through everything else. A low, rhythmic throb that didn't belong to the diner's ambient noise. Building in volume. Getting closer. Helicopter rotors. More than one. The frequency suggested military-grade aircraft. The kind of approach profile that came with clearance from ground control and a destination locked in before wheels left the tarmac. Megan's hand moved to her phone, then stopped. The encrypted line wouldn't respond. The handler had made that clear. She was on her own now, sitting in a diner 6 blocks from Cedar Creek Medical, holding a box of everything that proved she'd ever existed in this place, while military helicopters descended on a hospital that she'd just been removed from. She didn't move. She didn't stand. She sat exactly where she was and watched the sky outside light up with spotlight halos that cut through the rain like searchlights, and she understood, with the clarity that only comes after everything has already fallen apart, that she had no idea what was about to happen next. The rotor wash shook the windows of the diner. The rotor wash shook the windows of the diner. Megan watched the spotlight halos cut through rain like searchlights, and she understood that everything was about to fracture in ways she couldn't control. The coffee cup sat untouched on the Formica table, steam curling into nothing. Her reflection in the window looked like someone else's life. At 4:17 a.m., her phone vibrated once. A single text from a number with no name, Cedar Creek. ICU. Now. She was back in scrubs before the sun broke. The hallway smelled like antiseptic and something else, ozone, electricity, the sharp metallic tang of federal presence. 2 men in dark suits stood outside the isolation bay. Their badges said Department of Defense. Their eyes said they'd seen worse things than a suspended nurse walking toward them with her chin level and her hands steady. The new patient had arrived during the night. a former insurgent commander, 43, granted medical asylum through channels that required Pentagon authorization. Liver failure. 2 weeks to live without intervention. Cedar Creek had been selected specifically because of Megan. Because of what she could do. Because of who she was. She didn't know this yet. Not completely. The moment her face appeared outside his isolation room window, the patient's eyes locked onto her, and he began screaming. Raw, primal terror that fractured the early morning quiet. Al-Malakala Bayad. Al-Malakala Bayad. White Angel. White Angel. His voice shattered like glass against the reinforced walls. The four-stand rattled. Monitors spiked. Nurses emerged from stations, confused, reaching for sedatives. Megan stopped walking. Her hands didn't move. Her face remained level. But every muscle in her body went absolutely still, the kind of stillness that comes from combat training, from years of operations where a single flinch could compromise an entire mission. The hospital translator who'd been briefed by federal agents whispered into the chaos, he's saying the White Angel. It's a name. A legend. Someone from Baghdad. A Marine Corps colonel pushed through the crowd. His uniform looked like it had been tailored for authority. He was holding Morrison's military file, the real one, not the civilian version. The one with the seal and the redacted sections and the single sentence that changed everything. His voice was a command, not a statement. For extraordinary valor in Baghdad, Captain Megan O'Brien led a surgical team under direct fire, saving 17 lives including Lieutenant Commander Morrison during a compound breach. The room went absolutely silent. Nurses froze mid-movement. A monitor's beep seemed impossibly loud. Dr. Pierce had been standing near the nursing station, having arrived for his 5 a.m. rounds like he owned the building. His face went pale. Not red. Not angry. Pale, as if someone had pulled an electrical cord from his spine. A 2-star general entered from the hallway. His uniform looked like it had been pressed by someone who understood that precision mattered. He walked directly to Morrison's file, still held open in the colonel's hands. His eyes moved across the decorations, and then his hand came up in a salute, a crisp, formal salute that belonged in ceremonies, not hospital corridors. Silver Star. He pointed. The salute held. Then he moved to the next ribbon. Bronze Star with Valor. His hand didn't drop. Purple Heart. A pause. 2 purple hearts. The salute remained perfect, which meant everyone in that hallway understood they were witnessing something beyond protocol. Megan had not moved. Had not spoken. Had not acknowledged any of it. 2 Pentagon officials entered carrying tablets and federal credentials. They moved directly to the hospital administrator who'd just arrived, disheveled and confused. Captain O'Brien is classified placement, codename Angel 6. Her position here is part of an active intelligence operation. The complaints filed against her are to be disregarded, and any attempt to process them further becomes obstruction of a federal investigation. It wasn't a request. It was a command issued with the weight of classified authority behind it. Dr. Pierce's mouth opened. Closed. Opened again. Nothing emerged. His eyes moved from the general to the Pentagon officials to Megan, who stood in her scrubs with her hands at her sides, looking exactly like what she'd been pretending to be and also like nothing that had ever walked through those doors. He turned and walked toward her. Fast. His voice came out high, strained. This is insane. This is a cover-up. She performed an unauthorized procedure. She violated scope of practice. I have documentation. We know you do, one of the Pentagon officials said quietly. We've been reviewing it. Dr. Pierce kept moving toward Megan. You're not even a real nurse. You're military. You've been infiltrating this facility under false credentials. That's a federal crime. That is classified, the general said, and his voice was the kind of quiet that carries further than screaming. And you, Dr. Pierce, are about to step back. Dr. Pierce did not step back. His hands came up, shaking now. "I'm calling my attorney. I'm calling the medical board. I'm calling." A visitor's phone had been recording for 40 seconds. The footage showed a man in a white coat, red-faced now, screaming accusations at a woman in scrubs while a two-star general stood behind her in full dress uniform. The video uploaded in the time it took for security to escort Dr. Pierce away from the ICU. By 8 a.m., it had 847,000 views. By noon, it had 3.2 million. The comments section filled with people identifying themselves as military families, as veterans, as people who recognized what they were watching, a man with credentials destroying himself on camera while berating decorated personnel who'd put on uniforms so people like him could walk freely through hospitals complaining about how authority should work. Dr. Pierce's medical school mentor, a retired Army surgeon named Colonel Dr. David Holloway, saw the video while reading the morning news in a sunlit kitchen in Bethesda, Maryland. He'd known Pierce since medical school, had written letters of recommendation, had introduced him to mentors and colleagues, had watched him build a career on the foundation of selective arrogance and the kind of insecurity that masks itself as standards. Holloway sat with the video playing for exactly 4 minutes. Then he began typing. The open letter appeared in JAMA Internal Medicine at 2:11 p.m. 1,200 words of precise, surgical language that disowned Dr. Pierce with the authority of someone who'd spent 40 years in military medicine and knew exactly how to identify rot when he saw it. "I made an error in judgment 23 years ago when I recommended this man for advancement in the medical profession. I make no such error now. What you are witnessing is not a physician exercising appropriate concern. This is an insecure man with institutional access attempting to destroy the reputation of someone whose competence threatens the hierarchy he depends upon. Captain O'Brien spent 12 years in combat zones performing triage under fire. Dr. Pierce spent 12 years in comfortable hospitals performing triage under fluorescent lights. The video you watched shows the difference between actual courage and the performance of it. I am requesting, formally, that the Medical Board of Colorado initiate a full review of all complaints filed against Captain O'Brien and against Dr. Pierce's clinical record." The signature line read, Colonel Dr. David Holloway, M.D., FACS. 38 combat deployments. Bronze Star with Valor. 2 Purple Hearts. The Medical Board began their investigation at 4:13 p.m. on the same day. By the time they finished, 6 months of depositions, background reviews, interviews with staff, analysis of Dr. Pierce's entire clinical history, they'd found that his complaints against Megan were meritless, but his own record contained 47 documented instances of treatment facility violations, 3 patient harm incidents that had been quietly settled, and a pattern of retaliatory behavior against nursing staff who questioned his decisions. His medical license was revoked. The malpractice settlement came 6 weeks later, $847,000, paid to 3 nurses he'd previously targeted. Dr. Pierce moved to Tucson, Arizona, where he took a position teaching basic life support certification to nursing students and security guards at a community college that asked no questions about his background. The name tag on his polo shirt read, Steve. He wore it like a uniform that didn't fit. Nurses in the hallway recognized him sometimes. They never said anything. They just watched him flinch when they called him doctor, then corrected themselves and walked away. But Megan wasn't thinking about any of that. She stood in the Cedar Creek Medical ICU at 6:22 a.m. on a Tuesday, 3 weeks after the reveal, checking vitals on a patient in Bay 7. Her scrubs were the same as they'd always been. Her badge still said nurse. The only difference was that now, when she gave an order, people understood that the authority behind it came from more than hospital protocol. A resident approached her with a question about a medication dosage. She answered, 0.5 milligrams for push, 3 minutes apart. Push sodium bicarb after the second dose if QRS stays wide. The resident nodded and moved. Somewhere in the building, Dr. Holloway's words were still hanging in the hospital air like a benediction. Captain O'Brien spent 12 years in combat zones performing triage under fire. Morrison was being transferred to Walter Reed for long-term rehabilitation. He could move his fingers now. Could track voices. The thoracotomy had saved his life. Everything after that was recovery. His son, Megan's son, was scheduled to arrive from his unit in 36 hours. The hospital administrator had offered her the position of Director of Trauma Services. Full autonomy. 6-figure salary. Chief of Surgery Protocol. She'd told him no, she was staying in scrubs. She was staying in patient care. She was staying exactly where she was because this was the work that mattered, not the title, not the authority, not the validation. The work. The staying. The hands that knew what to do when everything fell apart. The trembling wasn't fear. It was restraint. That evening, Morrison's commanding officer, a captain who knew her from Baghdad, who'd watched her work under fire, sat down in the hospital's small courtyard where rain was starting to fall again. Megan joined him without being asked. They didn't speak for exactly 4 minutes. Then he looked at her and said, "He asked about you." First time he's spoken a full sentence since he woke up. Megan nodded. She knew what Morrison had said. She could hear it in his voice before he even spoke it. He said, "Where's the angel?" The rain fell harder. Megan's phone buzzed once. A text from her handler, "Mission parameters complete. You're free to stand down." She deleted it without responding. Because she wasn't standing down. She was staying. The Pentagon could reassign her, rotate her, deactivate her clearances. None of it mattered. The work was the thing that kept you alive when everything else had already tried to kill you. And this, the vitals, the charts, the hands that knew exactly where to push and when to pull back, this was the only mission that had ever felt true. The quietest person in the room might be holding it all together. Please like this video, subscribe to the channel, and in the comments below, tell me, have you ever been underestimated by someone who had no idea who you really were?